to integrate health and wellness into education policy and practice, an opportunity to address some of the long-standing barriers that we have all faced in advancing student health and school wellness. It is important to understand that while ESSA allows or gives permission to states to consider the conditions of learning, to address the whole child, to support student health and wellness, there is nothing in the law that requires them to do that. That is why we are focusing on the development of state plans. We recognize that there are many organizations and stakeholders pursuing different policy solutions and allocation of resources through ESSA implementation. There is the need to make a strong case to policymakers, particularly at the state level, that promoting health will advance the goals of academic achievement for all and help close the achievement gap. It is our hope that this document provides a framework that will help you make the case that student health and wellness matters and to provide a very specific and actionable roadmap for states. We do not offer a single set of recommendations, but rather an approach and guidance for developing recommendations to meet the particular situation in your state. During this hour, we are going to first provide a brief overview of ESSA. People participating in this webinar have a wide range of knowledge about ESSA. Dana Carr from Moringa Consulting will provide a short outline focusing on ESSA and the opportunities to support student health and wellness. This will not be comprehensive, but just an attempt to level set the conversation. Then Nancy Katz, Director, School Partnerships for the Alliance for a Healthier Generation, will provide an overview of the framework. After that overview, we will have two presentations about approaches advocates are taking in 2 states. I will share our approach in Illinois, and then Amy Dyett, the Director of Initiatives from the Colorado Education Initiative, will talk about their approach. Then we will have time for questions. Audience members can ask questions by typing a question into the question box located on your control panel and click on the send button. Feel free to send questions through the questions box at any time during the presentation, and we will answer them during the question and answer session at the end. Before we start, I want to just tell you a little bit about Healthy Schools Campaign. Healthy Schools Campaign's work is based on the simple and common sense notion that healthy students are better learners and that health and wellness should be incorporated into every aspect of the school experience. We are based in Chicago, where we work at a school, community, and district level to foster school environments that support student health. We empower parents, principals, teachers, and community members with the knowledge and skills to bring health and wellness into their classrooms. We advocate for district policies and practices, for a strong policy environment, and we work to build the capacity of schools, the district, and communities to support sustainable and meaningful changes. We have had the opportunity to bring lessons learned from this on-the-ground work to the national discussion about school health. I have the privilege of co-chairing the National Collaborative for Education and Health with Trust for America's Health. The collaborative was formed almost 3 years ago to work at the intersection between health and education and to address systems barriers and leverage new opportunities for schools to create the conditions of student health and wellness. At our collaborative meetings this year, we talked extensively about the opportunity presented by ESSA to integrate health and wellness into education policy and practice. I am thrilled that one of our steering committee members, Alliance for a Healthier Generation, has stepped forward to work with us to just do that. A special thanks to the W.K. Kellogg Foundation, the Robert Wood Johnson Foundation, and Kaiser Permanente for financially supporting the collaborative, including the development of this framework. Nancy, can you tell us a little bit more about the Alliance for a Healthier Generation?
Thanks, Rochelle. I would be happy to. My name is Nancy Brenowitz-Katz, and I'm the Director of School Partnerships for the Alliance for a Healthier Generation. The Alliance was started 10 years ago by the American Heart Association and the Clinton Foundation. We work to empower kids to develop lifelong healthy habits by ensuring the environments that surround them provide and promote good health. We do this through our 4 main strategies: making community environments healthier, informing public policy, making the marketplace healthier, and addressing related health issues through partnerships. Approximately 35,000 schools across the nation are using our 6-step process to enact policy changes to ensure that children have access to healthy food and physical activity before, during, and after the school day. We also work with thousands of out-of-school time sites to integrate nutrition and physical activity into their programming. Through work such as our work with ESSA, as well as working closely with government agencies such as the USDA and CDC, we assist states, districts, and schools across the nation with the implementation of policies critical to children's health and wellness. We assist partners who do lobbying work by providing success stories and identifying champions of this work to speak to legislators. We also provide technical support to state, local, and tribal level school health policy efforts through our work with Voices for Healthy Kids. We work with industry through voluntary agreements to impact the composition of foods in the marketplace and to alter advertising practices. In addition, we work with the healthcare industry to ensure that children have access to medical care for the treatment of overweight and obesity. We are currently researching and seeking partnerships to integrate additional areas of health and wellness into our 6-step process. We are particularly interested in the areas of management of chronic disease and social and emotional learning. Thanks, Rochelle. Back to you.
So before we get into ESSA, I thought it would be helpful to define what we mean by student health and school wellness. We mean a school setting that understands and supports students' well-being, and student health is the foundation for learning. In this environment, good nutrition, physical activity, basic safety, clean air and water, access to care, and building the knowledge and skills for students to make healthy choices that will allow them to thrive. To us, a healthy school environment includes promoting positive youth development, cultivating supportive school climates, and providing students with opportunities to connect to one another, adults, and the school. When we talk about access to care, we include physical, behavioral, and mental health. We include dental and vision. We include prevention, screening, and disease management. In a healthy school, students learn through lessons and through examples to value their own health. Now, ESSA is the reauthorization of the Elementary and Secondary Education Act that was signed into law in 1965 by President Johnson, who believed that full educational opportunity should be our first national goal. From its inception, ESEA was a civil rights law and the federal government's involvement in education, which is largely seen as a state and local responsibility, is to address equity. Sorry about that. For the last 15 years, No Child Left Behind has been the nation's education policy. The theory behind NCLB is that schools and school districts needed to be held accountable for student performance, and if standards are not met, then first schools received additional resources. And then, if improvement did not happen, more punitive measures were taken, like removing leadership or being taken over by the state. Another key element of this approach was public disclosure of information in the form of school report cards. School report cards are designed to grade the school on how they were performing on key metrics. Report cards are required to break down student performance by race. This information was shared publicly and compared the school's performance to other schools in the district and the state. ESSA is based on the same theory of change with a number of key differences. A recognition that the conditions of learning matter, less prescriptive, less punitive consequences, a broader sense of how to measure student performance, and a bigger role for states. Again, states have an invitation to leverage ESSA to advance student health and wellness, but this is not a requirement. I am now pleased to introduce Dana Carr from Moringa Policy Consulting, who will provide us with an overview of ESSA. Dana has a long career working on school health, both with education and with health. For almost 8 years, Dana worked as the Director of Health, Mental Health, Environmental Health, and PE programs at the U.S. Department of Education. Since 2011, Dana has consulted with public health and education agencies, nonprofit organizations, and foundations to advance individual, school, and community health. Dana?
Thanks, Rochelle, and hello to everyone. Before I start and jump in talking about ESSA, I wanted to provide a brief context for our discussion. We're talking today about ESSA because the law opens up new opportunities and possibilities for us to reimagine education policy and practice. But this is not our only opportunity or avenue to imagine and implement health-promoting schools. We have other supporting endeavors in the field that will ensure that our kids have access to healthy foods and physical activity, for example, such as nutrition guidelines and requirements for healthy snacks in schools, as well as local wellness policies that ensure all school districts have policies related to nutrition and physical activity. States also already have laws and policies that govern many aspects of health and health-promoting schools, such as related to physical education requirements, green cleaning, asthma management, and bullying, for example. So I'm not going to talk about any of these other opportunities, but wanted to mention them because they are important as we think about the landscape of healthy schools and policy options and avenues we have available to us, and why we prioritize some areas of focus over others in our work. Again, we're focusing today on ESSA, as Rochelle said, because we have an especially fortuitous opportunity right now to fundamentally change the way that schools and educators think about this intersection between academic outcomes and health, and how to intentionally incorporate this into education policy and practice. Very quickly, I want to point out a few similarities and differences between the version of the education law with which many of us are familiar, the No Child Left Behind Act, NCLB as we call it, and the new law, ESSA. In terms of similarities to NCLB, ESSA maintains high expectations for achievement for all students in our public education system. The law continues to require periodic assessment of students disaggregated by population subgroup to maintain a focus on educational equity, and ESSA maintains flexibility for state and local innovation. In fact, one of the hallmarks of ESSA is the return of authority to state and local educational authorities with respect to deciding accountability measures and improvement approaches. ESSA also has less categorical funding than NCLB, which provides additional flexibility for state and local needs and approaches. Another difference in ESSA is a concentrated focus on addressing the needs of the whole child. ESSA was crafted taking into consideration the best research and practice from the last 15 years since NCLB was passed. So ESSA provides authority for state and local education leadership to thoughtfully build education systems that support kids' optimal development, both in terms of health and well-being and academic outcomes. To be clear, the law includes both implicit and explicit authorities to do this work, and it is our task to take advantage of these authorities. Although there are 9 titles in the bill, we focused on 3 titles. Title I, which provides funding to states and school districts with high percentages of low-income children and ensures educational equity for all students in public schools. Title II focuses on professional development and ensuring excellent educational leadership in schools. And Title IV provides funding to support school success and enrichment by providing well-rounded education to students. Title I is designed to provide all children significant opportunity to receive fair, equitable, and high-quality education, and to close education achievement gaps. This section delineates the responsibilities of state and local educational agencies to ensure the infrastructure, accountability, and support for high-quality education. As was the case under NCLB, states are required to create a plan that includes many of the components that I talked about and lays out the steps they will take to ensure high-quality education for all students. The law requires that states engage stakeholders in creating these plans. As part of the plan, the state must adopt challenging academic standards. ESSA states explicitly that these standards are not limited to language, arts, and math, though, and could include any subject that the state decides, including, for example, social emotional learning standards. The law also requires that states have assessments to measure students' proficiency against standards, and again, explicitly pointing out that this does not only mean language, arts, math, and science, but can include assessments on subjects that the state identifies. For example, it could mean including fitness assessments, which several states already require and use. ESSA also requires that states develop accountability systems and metrics, which we'll talk about in a little more depth in a few minutes. These accountability systems are intended to help states and school districts get a better look at how their systems are working and are intended to help identify schools and subgroups of students that might need additional support and improvement interventions. The system is really intended to provide specific input to educators and policymakers to improve educational quality. ESSA introduces some more nuanced requirements for these accountability systems, which must include academic measures such as graduation rates and academic proficiency on assessments, as was required under NCLB. But ESSA also requires at least one indicator of school quality and student success, which is a new requirement. These assessment metrics will be used by the state to identify schools and groups of students within schools that are not meeting proficiency benchmarks and to receive school improvement interventions, which will be determined at the district and school building levels. Those schools identified for improvement must undertake comprehensive needs assessments to prioritize areas most in need of attention and improvement. These needs assessments should inform improvement plans. States must also continue to provide state report cards, which are more outward-facing and are intended to provide the public with a quick glance of the metrics at the state level, as well as by each school district, including proficiency on state assessments. But now these report cards are also required under ESSA to include school climate surveys, safety reports, including incidents of violence and bullying and harassment, as well as chronic absenteeism rates, which provide the public with a more comprehensive picture of the learning environment in schools. States are also invited to include any other data that the SEA believes will best provide parents, students, and other members of the public with information regarding the progress of each of the state's schools. This gives significant leeway to states to include indicators such as whether the district, for example, meets PE requirements, whether they've been recognized for having good nutrition environments, or are meeting measures of environmental stewardship. As ESSA is signaling a potential shift in policy, practice, and pedagogy, the law also includes funding and authority to ensure that our educators, from teachers to administrators, are sufficiently prepared for the changes in their schools. Under ESSA, funds can be used to help fund pre-service and in-service training for educators, which could potentially be used for helping them better understand and implement interventions that address health and well-being, including social-emotional learning. It's also important to remember that schools are work sites, and by improving conditions for students, we have the opportunity to improve working conditions for the adults in the building, hopefully reducing teacher burnout that leads to staff turnover, particularly in our most challenging schools. Title IV explicitly calls out the need for a well-rounded education, which deliberately addresses the complaints about NCLB's narrowing of the curriculum. Under this new law, a well-rounded education includes physical education, arts, music, and technology, and makes funds available to districts to integrate these components into schools through student support and academic enrichment grants. This block grant program consolidates many discrete funding programs that existed under NCLB that provided health programming. And under these new grants, school districts will have to specify what they're going to work on, what their activities are. And it's important to note that if a school requests $30,000 or more for all of their activities, the law requires that at least 20% of those funds be spent on health-related activities that, quote, support a healthy, active lifestyle, including nutritional education and regular structured physical education activities and programs that may address chronic disease management with instruction to help maintain the well-being of students. To receive the block grant, school districts will also have to undertake a community needs assessment and consider stakeholder input, which is a great opportunity for advocates, policymakers, parents, and caregivers, community members to engage in defining the scope and needs and activities at the local level. Title IV also includes provisions for 21st Century Learning Centers, an important source of out-of-school time programming and support, as well as community schools in promise neighborhoods, which provide full-service wraparound models for communities. The law also includes several other opportunities to highlight student health and well-being. Based on the last 15 years of research, the law highlights the importance of conditions of learning and requires that states support school districts in addressing these conditions of learning, specifically around bullying and harassment, discipline policies, and the use of adverse behavioral interventions. ESSA also emphasizes the importance of our youngest learners and their needs, ensuring strong transitions from early childhood to elementary school. School districts must also consider how they will ensure that this transition is a smooth and productive one for students, and they can also use funds to provide early education experience if they choose or require to do so. So state plans, Title I requires that state plans describe their standards, assessments, accountability measures, and methods for engaging stakeholders. And they are currently in the process of convening stakeholders and soliciting input on these state plans. They are required to submit these plans to the Department of Education in March of 2017 or July of 2017, and the new state plans are to be put in place and in effect starting the next school year, 2017 to 2018. This school year, 2016-2017, is a transition year to allow the Department of Education to finish releasing regulations and guidance and for states and school districts to determine their paths. So if you have any questions about where your state is in their process, we refer you to ASCD's ESSA State Implementation Map, which is in our framework document on page 7. And with that, I turn it back to Nancy. Thank you so much.
Great, thanks, Dana. So approximately a year ago, Rochelle spoke with Brian Weaver, our Chief Program Officer, about partnering on the critical work around ESSA. It has been such a pleasure working with the Healthy Schools campaign, and I'm thrilled to have the opportunity to provide an overview of state ESSA plans to support health and wellness, a framework for action. The purpose of this framework is to assist health and wellness stakeholders in getting involved in state-level conversations around ESSA. As discussed previously, states are currently working on their ESSA state plans, and this provides an amazing opportunity for health and wellness stakeholders to have their voices heard. The framework provides background information on ESSA and the key opportunities to integrate health and wellness into ESSA state plans. It's really a how-to guide. The Getting Started section provides a wealth of resources to assist the user in learning about the health and education landscape in their states and determining the best way to approach education stakeholders. The Engaging Stakeholders section provides guidance on the requirements within ESSA on stakeholder engagement and how the user can connect with like-minded partners. The Key Levers section identifies the key areas of opportunity within ESSA to integrate health and wellness. We will discuss these in a little bit more detail in one moment. The Transferability section briefly discusses the ability of states to transfer funds between titles of ESSA. The implications of this are not entirely clear. For example, if the state creates an accountability system that supports health and wellness, transferring funds to support that system could be beneficial. However, if the plans for using the Title I funds are not aligned with the state's priorities, taking away from the Title II or IV budget could be a concern. Finally, we discussed the student support and academic enrichment grants in Title IV, as Dana just mentioned, and we discussed the potential uses for these grant funds. Although this grant program is not part of the state ESSA plan, we included information about it because the funding explicitly mentions school health. The approach that we recommend is a comprehensive approach. The integration of health and wellness into ESSA will be most effective when accountability systems and report cards are linked to needs assessments, evidence-based practices, and professional development. We will share an example of this approach shortly when we discuss the Healthy Schools campaign's efforts in Illinois. Another important aspect of our approach is that we build upon existing structures. It is critical to know what policies and data systems exist in your state so that existing resources can be leveraged. For example, does your state already require a health and wellness survey at the school or district level? If so, it would be much easier to make the case for some of this data being reported on a school report card than it would to suggest something that would require an additional data collection effort. Dana touched upon the variety of health and wellness policies that might be present in your state. There are key areas where health and wellness can be integrated into the ESSA state plans, and the document is organized around these key areas. As stated previously, we also want to make sure that the approach is comprehensive and that health and wellness are threaded throughout the state plan. The key levers discussed in the framework are state accountability systems, state report cards, needs assessments, professional development, transition from early childhood programs to elementary school, and well-rounded education. Each of the key lever section is organized in the same way. First, we provide background on the lever and why it is important for advancing student health and wellness. Next, we outline what the law says about each lever, and finally, we provide specific action steps to work on the lever. The document also includes case studies, links to supplemental information about a select set of measures which are listed here, and links to other valuable resources. We consider the release of the framework the first phase of our efforts, and we have more work in progress. We are currently working on recommendations around specific school health issues to complement the framework and provide a very specific roadmap for advocates to use to support their issue of concern. In addition, the National Collaborative on Education and Health is working with the Pew Charitable Trusts on a health impact assessment of the needs assessment requirements within ESSA. The results of this should be released early next year. Finally, we will update all of our resources based upon final rules from the Department of Education. Now I will turn it back over to Rochelle, who will present the approach that the Healthy Schools campaign used in Illinois.
Well, thank you, Nancy. It's been a pleasure working with you and your team on this important work. I wanted to share our approach in developing recommendations for Illinois State Plan. Each state has developed their own process for soliciting input from stakeholders. This information can generally be found on your State Board of Education's website or consult the Getting Started section of this framework. Illinois released their draft state plan early in August, and we are currently waiting for them to release a second draft for public comment. The two principles that Nancy mentioned earlier guided the development of our recommendations. First, we wanted to offer a comprehensive approach, one linking accountability systems and report cards to needs assessment, evidence-based interventions, and professional development. When we consulted with other stakeholders, we found so much concern that the overall system of accountability was punitive and would punish schools rather than support them. By emphasizing the interconnectedness of our recommendations, we hope to emphasize the need for an approach that was supportive of struggling schools and communities. Second, we recognized the limitations of time and capacity of our state board and focused on leveraging and building on the current policies and practices already in place. For us, that meant focusing on chronic absenteeism and school fitness as part of the accountability system. In Illinois, the state already includes chronic truancy on its report card, and they recently established an attendance commission to look at chronic absenteeism. Combined with the fact that chronic absenteeism is already required under ESSA to be on the state report card, this led us to recommend that chronic absenteeism be included in the state's accountability system. A link to a fact sheet about chronic absenteeism can be found on page 12 of the framework. At this time, we have not recommended a specific metric. ISB, our state board, has not released their proposed accountability structure yet. Once that has been shared, we will make a specific recommendation. However, we did highlight in this document how Connecticut is looking at chronic absenteeism. In Connecticut, schools can receive up to 100 points for this metric, with up to 50 points for their overall chronic absenteeism rate and up to 50 points for a high-need subgroup chronic absenteeism rate. More information about Connecticut's approach can be found on page 11. We also decided to focus on student fitness. Illinois recently required all schools to implement student fitness testing and report on that data. Given that commitment, we are recommending that student fitness be included in the accountability structure. While we have held off on proposing a specific metric, we once again refer to Connecticut, which currently has a student fitness measure in their accountability system. They measure the percentage of students meeting or exceeding their student fitness test. Both of these metrics meet the requirements for an indicator of school quality, and those requirements which can be seen on your screen. The metric has to be valid, reliable, and comparable. It needs to be disaggregated by each subgroup of students. It needs to include a different measure than the state uses for another indicator. It needs to be supported by research finding a connection between student achievement, and it needs to aid in meaningful differentiation among schools by demonstrating varied results across schools. As mentioned earlier, we wanted to offer a comprehensive and supportive approach linking metrics in the accountability systems and report card to the needs assessment, the evidence-based intervention, and professional development. For example, for chronic absenteeism, we are recommending that the following measures be added to the school report card: school breakfast participation, compliance with state laws relating to healthy school environments, and the ratio of students to school nurses and mental health professionals. There is existing evidence that each one of these factors is an important aspect of improving attendance. We also recommend a needs assessment that helps schools understand the root causes of chronic absenteeism and should help schools create coordinated interventions that include school and community-based resources. We recommend that ISB include some of the following in their needs assessment: information about the health status of students, measures of school climate, school discipline policies, and others. Based on the findings from the school's comprehensive needs assessment, school districts can opt to use Title I funds to target policy, program, and practice interventions to address the root causes of chronic absenteeism. Finally, we recommended that ISB provide support to school districts around evidence-based policies and practice, as well as professional development. Our full response is included can be linked to from page 4 of the document. Now it is my pleasure to introduce Amy Dyett. Amy is the Director of Health and Wellness for the Colorado Education Initiative. She oversees Colorado's Healthy Schools Smart Source data collection, Colorado's Healthy School Champions Recognition Program, statewide Healthy School District grants, and the youth-driven Community Health Action Teams. Amy was a 2012 Education Policy Fellow and received her BS in Biology and Biomedical Sciences from Colorado State University and her MS in Teaching from University of Northern Colorado. Amy, thank you so much for joining us today and sharing your work in Colorado.
Thank you, Rochelle. I appreciate that. And like Rochelle said, there is an allowable opportunity in ESSA right now for health and wellness to really be integrated. But we need to make a case for this change. Let's do what's right for students and really see what an education can look like when health and wellness is foundational to student achievement. Like Rochelle said, next slide please. My name is Amy Dyett and I work for the Colorado Education Initiative, and we are a nonprofit. We work closely with our Colorado Department of Education to accelerate educational improvement and innovation across Colorado. And what that really looks like is equity, the belief in the power of public education, and investing in educators so that there is an effective leader in every school, an effective teacher in every classroom, and a healthy and safe environment that really ignites a passion for every student. We work across education spectrum and currently have 5 bodies of work spanning from professional learning, which focuses on the development of all educators, next generation learning, which provides personalized and individualized teaching and learning experiences for students, Colorado Legacy Schools, which increases not only the number but the diversity of high school students who are not only taking but passing advanced placement classes, science, technology, engineering, and math, or STEM, and we are bringing in the business sector to education. We have our STEM Champions Network, which brings in corporations like Boeing and Lockheed to have a conversation around how can we create youth so that tomorrow you can hire them in your organizations. And then, of course, health and wellness. Next slide, please. Within health and wellness, what we look at is how do we strategically align health and wellness efforts to boost academic performance for all students. And we do that through a variety of ways. CEI is really that intersection between health and education. We connect those language barriers. We see where there are opportunities for health and wellness, what's already being done, and how do we support our schools and districts with the professional development, the resources, the data, the infrastructure, and really the knowledge to meet the needs of those students. We pull together our various agencies, whether it's the Department of Education, our Public Health Department, our Department of Human Services, to really look towards, let's leverage our best and promising practices. Let's translate those health and education policies. Let's foster collaborative partnerships at the state and at the community level, and let's promote data and accountability systems. Next slide, please. ESSA really is what we see our opportunity to provide more accountability and more clout to health and wellness. and we took an approach to systems change. We actually used a lot of documents released by the Healthy Schools campaign, so thank you, Rochelle, for that, and really tried to, one, become more informed. Let's learn about ESSA. Let's be able to join those conversations. You have more clout in the eyes of schools when you can speak their language and understand what they're dealing with, what they're held accountable for, what the education system looks like. So we learned more about ESSA. We identified specific opportunities for school health, and also it's really important to know the politics and prioritize your actions accordingly. So at CEI, we don't advocate or lobby, but we work closely to be that third-party validator and take the laws that are now passed and provide an understanding and resources to schools and districts so that they can then start implementation. Next slide, please. So around ESSA, we know it replaces No Child Left Behind. We know it governs all aspects of the education system. That goes from the classroom level, the building level, and the district level. Like Dana said, the major changes are really the point of control, having a well-rounded education, and really starting to talk about equity instead of equality. Next slide, please. We saw this as a huge opportunity because this is something that we do. We are looking at equity. You can see the picture on your screen. Equality is giving kind of a one-size-fits-all. Let's just give the same to everyone. Equity is really looking at meeting the unique needs of each individual student and making sure that they have what they need to achieve at the same rate as their peers. Next slide, please. The opportunities for school health that we really identified go right along with what Rochelle says and what the framework will identify. But we are using this as an opportunity to make health more foundational to the education system in Colorado. So we know we're starting to talk about well-rounded education. We know that replaces core. That definition includes health education and PE. In Colorado, we already have rigorous standards around comprehensive health and PE, but this gives us a better opportunity to ensure that it truly is taught in all schools across the state. This allows us an opportunity to use, for the first time ever, Title I funds to help us make sure that we have health teachers in the classroom. We're looking at our state accountability systems. Right now in Colorado, we look at academics, academic growth, growth gaps, post-secondary, and workforce readiness. This fifth indicator that's around school improvement and student success or school quality, we are in those conversations. We are looking at what are schools in Colorado already being asked to collect. So let's not reinvent the wheel if we don't have to. We are then looking at what are all of the student level indicators that are out there that would relate to health and create change, and more importantly, give data to schools that's going to help them drive their decisions to meet the needs of their students. It's going to help allocate resources to truly make a difference. So in our state right now, we're having conversations around this accountability system and what this fifth indicator will look like. We have a list of non-academic indicators, and we're going through them to really look at what meet the requirements under ESSA, what are reliable and valid, and more importantly, what can be disaggregated by each of those subgroups. We're also looking at Title II. For the first time, Title II really applies to all school staff. It's a broader definition for professional development, and we see this as an opportunity for our schools to really look at how do you train staff, for some schools for the first time ever, around behavioral or mental health needs of students, around mindfulness, around creating those relationships with students, around the brain-based learning of physical activity and why brain boosters in the classroom are so important, and looking at how we get those skills in the hands of educators so that it's not something extra or on the side, but it's something that's part of their classroom management. It's a part of the system and a part of the day at each school. Next slide, please. We are also looking at opportunities, of course, within Title IV. We're really seeing this as student support, academic enrichment. This is our health and wellness. However, it really comes down to federal appropriations and the dollar amount that will be tied to these. We know that in Part A, if schools get more than $30,000, they have to spend 20% of that on that well-rounded education, 20% on that safe and healthy students, and 15% on the effective use of technology. We know that in Part B, it's looking at school community partnerships. It's the Century Community Learning Centers. It's funding after-school programs. And with all of this, it's looking at a needs assessment and an implementation plan. So what do we already have going on that's great? In Colorado, we already have a lot of programs. We already have a lot of funders in this area. So how do we leverage partnerships? Next slide. Because of CEI's unique positioning, we work to create, build, and strengthen relationships at all levels within our Department of Education. in Colorado, we are doing what we're calling hub and spoke model. So in order to solicit input, we look at having a hub. Next slide, please. On this hub, we have 2 of our legislators, we have 2 of our state board members, we have all of our membership agencies, and we have some of our advocacy and lobbying groups. We then have spoke committees, and these spoke committees are really the ones putting pen to paper. They are organized around the main pieces of the ESSA state plan: standards, assessment, accountability, school improvement, quality instruction and leadership, title program, and stakeholder consultation. We sit on these spoke committees. We have also been seen as connectors to the field of practitioners, so that we helped our Department of Education make sure that we had voice from the field, more importantly, sitting on these spoke committees to make sure that we're listening to them. Next slide, please. So we wanted to take an additional opportunity to convene the field. You know, our Department of Education had a plan in place to engage and solicit input. They did a round of what we called listening tours back in May, where they went regionally, and whoever wanted to could come and learn kind of a one-on-one about what is ESSA. But we wanted to take that a step further. How do we make sure that the field not only, one, knows what ESSA is, because we're finding that especially at the teacher and even principal level, if they've even heard of ESSA, it's simply at the level of it replaces No Child Left Behind. We really don't know what's coming, and implementation starts in August. So let's convene the field. Let's create awareness. Let's inform them so that they can provide meaningful insight, feedback, and voice. They are the experts. Let's give them the tools to be the champions for this work, especially around health and wellness. We're also using relationships with our membership organizations, so our Colorado Association of School Boards, our Association of School Executives, the Colorado Education Association, to host a variety of events. Next slide, please. Some of these events include, like I said, our Department of Education did listening tours. They also have a very nice newsletter that will update anyone who wants to receive it on what is happening in Colorado around ESSA. We held a professional learning community for all of our Healthy School Champions, which in Colorado is really a broad term for who takes this on in your school and district. It could be a specific position like a wellness coordinator at the district level, or it can be whoever wanted to take this on. We have everyone from the superintendent to grant writers to parents to teachers to the janitor. And we wanted to bring them together because systems change starts with awareness. We wanted to make sure that they could meaningfully engage. We know that in Colorado, between December and February, there will be a public comment period once our draft plan is written and out there. So how can we, again, convene the field to make sure that they have the opportunity to not only understand, read the draft, and then provide input? So we're working with those membership agencies and with our agencies and membership organizations to host what we're calling an ESSA Summit in January. We're going to invite all of our school and district folks. We're going to invite our spoke and hub committees, and we're going to have people in the room together to provide meaningful input to the plan. Next slide, please. We also thought it was vital to build upon existing work. Let's not make health and wellness one more thing. Let's integrate it into the system. Next slide, please. For example, in Colorado, we have the Healthy School Smart Source. And Smart Source is our inventory to assess policy and practice at the school level. It looks at a comprehensive approach of all areas across Colorado. It streamlines data collection so that, most importantly, it decreases duplication and burden on our schools of what data they're being asked. And then more importantly, it gives that data to schools. Schools get their own data. They get a comparison of the district or region if they're enough to participate. They get a state aggregate. They get then what is best practice. And it ties to our best practice guide to try to make the data more actionable. We developed this by using our stakeholders, many of our school and district voices, our funders, our content experts, state agency reps, researchers, and evaluators to create this tool. And the way that we picture this within ESSA is to connect it to our needs assessment. In Colorado, we have a pretty general, broad needs assessment. We want to include health and wellness indicators, and when health and wellness indicators are selected on that broad needs assessment, we want schools to really look at then, let's dig in. Let's look at our student level health and wellness using, in Colorado, we call the Healthy Kids Colorado Survey, which is a version or includes a version of the YRBS or the Youth Risk Behavior Survey. And let's look at the school level. Let's see what policies and practices we are already offering, where are our gaps, and how do we allocate resources more appropriately. And so this deep dive could be SmartSource. Next slide, please. And we also know we still need to make the case. We'll never hear a teacher or principal say they don't care about the health of their students, but right now, they're not held accountable to it. How do we continue to be the voice, continue to create that awareness, share the research and data that's out there, and make the case that healthy students are better learners? Next slide, please. What's interesting is through the work that we've done and through convening our various stakeholders, we have found that I not only need to make the case for why health and wellness champions should care about ESSA, because that's not in their day-to-day work. Some of them don't get involved with state report cards, with accountability, with improvement planning. So making the case for them to understand that our ESSA state plan will drive school and district level priorities and funding allocation. Really what is included in this plan is what gets measured and accomplished on an ongoing basis. And we know that health is foundational to a student's ability to learn, and this lends that clout for integration. This is our opportunity to be forward-thinking, to give relevance for the work we have done for years. What we've been able to do with this is really show that even if health and wellness isn't written into each detail of our plan, what really comes down to is implementation. Next slide, please. So we've been making the case to educators, our agencies, our Department of Education for why health and wellness fits within ESSA. And it's because healthy students learn better, and I think we all know this. Increased learning readiness, increased school engagement, increased academic performance, decreased absenteeism, behavioral issues, truancy. We need to start talking about what schools are held accountable for in terms of graduation rates, attendance, and test scores, and really looking at how health and wellness will help those. So that is what we are doing in Colorado. We are working hard to get whatever we can, next slide please, integrated into our state draft plan. And again, it'll come down in implementation. So this is our first step. We are hoping to have our draft plan done by March or April so that our State Board of Education can review, sign off, and hopefully submit to the federal government. If you have any questions, again, my name is Amy Dyett at CEI in Colorado. Thanks, Rochelle.
Well, thank you so much, Amy. And now is time to take questions from the webinar participants. So, Whitney, can you tee those up?
Yep, absolutely. So there have been a lot of questions coming in, and I'm going to actually consolidate and kind of rephrase some of them so that we can hit multiple ones at a time. So if you don't hear your question specifically being answered, know that we're doing our best. So the first question I would like everyone to answer is if you could talk a little bit more about how the different stakeholder groups should be involved. And related to that, if you are in a state where you don't feel like your state has been really great about genuine stakeholder involvement, what would be your advice for those advocates that are on the call?
Amy, do you want to take a first crack at that?
Yeah, I'm happy to. The approach we've taken in Colorado, and you know, we really are kind of at the far right spectrum of local control, is to take this at a community approach, to work with districts and even at the school building level to ensure that they already have wellness teams created, and those wellness teams are comprehensive, including teachers, you know, school staff, principal, students, really important, parents, and community members. And if you're already involved in some of those conversations, we then take that wellness team. How do you make yourselves more accountable? How do you start to partner with your PTO or PTA? How do you make sure that you're talking to your school accountability committee? And some of our wellness teams are actually one and the same with their accountability committee. So we've really done that at a community level. At the state level, for the first time ever, within our hub and spoke model, we have what we're calling the stakeholder group. And what that group really looks like right now is a lot of people from the field, but can it include our community partners? Can it include parents? We've been using some of the organizations to represent those voices, such as our, you know, state PTA, such as, you know, our kind of state, what we call SACPI, which is the School Council of Parent Engagement. But that's really the approach we've taken.
So I think that, Sister Rochelle, if you are having trouble figuring out how to engage with your state, first of all, obviously start with going online and trying to find the ESSA section and trying to find what their kind of formal process is and make sure that you participate in that formal process. If for whatever reason that formal process isn't working for you, I think that you have the opportunity to reach out to your state superintendent or someone on their staff, find out who it is that is leading up this work. There will inevitably be a team of people that are charged with leading this and potentially even leading the community engagement. Secondly, reach out directly to your state superintendent's office. And also reach out to board members or find out when the next state board meeting is and show up and express your interest and desire to be involved. Obviously, politics in each state is different, and the relations of power between your state superintendent, their school board, the governor's office, and the state legislature are all different. And in the guidance, we provide a link for you to at least understand what the structural relationships are. But there is the opportunity of reaching out to your state legislature, members of the education committee, who, while not officially involved in adopting these plans, play a very important role in the conversation. So I think that there are a number of avenues to try to make your voice heard. And then, of course, there is the opportunity to write letters to the editors or other kinds of more public engagement.
Great. Thanks so much. So there have also been a lot of questions about whether or not specific indicators would work and whether or not they should be adopted. So I guess the question I would like to pose is, what advice do you have in terms of the discussion about selecting indicators? And I know Amy talked a little bit about what they've done in Colorado. So I don't, without getting into the specifics, is there any advice you have about how to go about selecting them?
So this is Rochelle, and then I would like to ask Dana to jump in, or Nancy. I think that the most important thing is to make sure that, first of all, you can readily and easily articulate the connection between the indicator that you want to offer and learning and academic achievement and disparities. And then going back to the requirements of the indicator, making sure that you are actually meeting this. I think you don't want to get in a situation where you're recommending something that really just doesn't fit the structure of the accountability system, and then in that case you might want to think about making it part of a school report card or the needs assessment. One of the things we'll talk about at the end is that, as Nancy mentioned, we're going to be working on addendums to the document that are designed to address specific topics. We're going to start with nutrition and physical activity and chronic absenteeism, but we hope to address other topics. And if anyone who is participating, if your organization has a particular expertise, we would be happy to work with you on developing those kind of guidance, looking really in deep at that question of, if you want to promote social and emotional learning or chronic absenteeism or physical education, what is the best way to do that? Dana, did you want to add anything?
Yeah, thank you, Rochelle. This is Dana. The only thing I would add to your excellent comments is to really look at and be very critical and think about what is already going on in your state. What data systems and what data points do you already, does your state already have access to? What are interventions or sort of systems level pieces that are already in place that you're already thinking about? So Rochelle talked about how Illinois is already working on chronic absenteeism, as I imagine many states are, and really digging into that and looking at what data are available to point at the state level or the district level or the school building level to what are some of the root causes of chronic absenteeism, and then integrating some of that work into looking at how would we address that through the local needs assessments and then through school improvement plans. But really, again, sort of looking at what data are available not only within the education department or the education sector, but what data systems do some of your partners potentially have that could lend and illustrate and bring out some of these other issues. For example, your public health department partners, hospital or other healthcare sector partners are possible. They also sit on a lot of data systems as well. So really thinking very critically about what do you already have in place, where is there some energy in the state already, what are some of maybe even your neighboring states or districts within your state, what are they doing that looks innovative and is complementary to what you're already doing. And then the other thing I would just add too is that although this is a beautiful opportunity right now, this isn't the only opportunity moving forward. So if your state isn't really sure how to measure some of the great work potentially, for example, around school climate, it is something that you can think about. How do you scale up data systems now that can inform addition of an additional measure into your accountability systems in a few years when you are better able to answer the questions that you're asking.
Great, thank you guys. I just want to there seems to be a lot of people mentioning the fact that school nurses can be a really great partner, and I just want to agree. It's not necessarily a question, but we've gotten several mentions of that. So I just want to make sure that, you know, just because we're not mentioning specific populations, we definitely, I think everyone would say we agree school nurses are important. So my next question, and this might be one of the last questions, is if you could talk a little bit about the timeline and even down to kind of how will schools know when these changes are being made and the policies, and just kind of how the implementation of all of this might work? I know that's a big question, so I apologize.
Dana, can we call on you to help us?
Yeah, sure, this is Dana. To the best extent that I can. I think that in terms of the timeline, I think what we have heard from the department is that state plans, again, are due to the department for approval in either January or, did I say March of 2017. And I think we just go forward with that until we hear otherwise. I think in terms of how that gets trickled down to the school building level, that will largely depend on your state and on your local educational agency. I imagine that states will be pretty vocal. I imagine that you'll be hearing a lot about it in the media. Your school board should be communicating about this at the state level and the local level. And there will, Amy, yeah, I would turn to Amy too, how this, you're envisioning this gets communicated out moving forward and to really the nuts and bolts of implementation during the next school year.
Yeah, Dana, that's something we're still discussing in the state right now. We've really been focused on getting these drafts done, but specifically our organization would like to, you know, host a round of kind of regional trainings, maybe another summit. Let's get the information out there as soon as we know. I think the challenge, the timeline that everyone is kind of seeing is that whether you turn it in the March deadline or the July deadline, you know, you're still looking at a possibly 90-day turnaround from the federal government, and so we may not even hear if it's approved until, you know, August or even into October, depending on when we apply. And so really focusing on what will implementation look like. We know we need to get some of the new applications out this spring in order to give title funding for the next school year. So we're really looking at possibly keeping our hub and spoke model going to continue to inform the process, and starting with the draft and then going to implementation. As well as, you know, hopefully that's really where CEI can step up and provide that support in our state.
So just one final comment from me. It's messy, and it was going to be messy even if we weren't in the middle of a